Okay, we're going to take our seats for the second half of the workshop. Okay, for our final three speakers, as I mentioned, we're going to talk more about revenue streams and funding opportunities. So we're going to start with Ms. Heidi Wallace, who serves as the Executive Director of the Nonprofit Association for the Creatine Deficiencies, and she will explore how to diversify an organization's revenue stream. Then we have Ms. Heidi Bjorn Pennell, the Senior Program Manager overseeing RARES 1 program at the Chan Zuckerberg Initiative at CZI. She will be speaking on CZI RARES 1 grant funding program and support for capacity building. Then we have Ms. Carly Patterson, the Senior Advisor in the Office of the Chief of Comparative Clinical Effectiveness Research at the Patient-Centered Outcome Research Initiative, or PCORI. She will share information about PCORI and their funding opportunities for rare disease research. So thank you all, and we'll start with Heidi.
All right, well, we are actively diversifying our revenue streams. I think this is an ongoing process for all of us, and I think there are a lot of people here that can teach me many lessons, especially the people that spoke this morning. So thank you for having me. My name's Heidi Wallace. I'm the Executive Director for Association for Creatine Deficiencies, and I'm gonna learn the trick of the buttons, maybe. Are we? Towards the back at every angle possible. All right, not working. I'll start talking while I wait for my slides to advance. So we represent 3 different creatine deficiency disorders, and I'm gonna talk through kind of where we've been, and I'll spoil it and say we're hitting phase 3 right now. 2025 is our year. So how did we get here, and what do we plan to do in 2025? We have 3 creatine deficiencies that we represent. They are AGAT, GAMT, and CTD. 2 are enzyme deficiency disorders, and 1 is an X-linked creatine transporter deficiency. All are ultra-rare disorders, and my 2 children are affected by GAMT deficiency. At the top is Samantha, who is now 21. These are pictures from around the time of her diagnosis when she was 5, and after years of developmental delays, started showing signs of absence seizures, and we discovered that she had GAMT. And her younger brother, Louis, who was diagnosed at birth, who is now 13. And for my children, they just needed to be following a routine every day of taking creatine for all those years. And my daughter would be okay. My son is okay. He's doing great. But that is not the case for creatine transporter deficiency, which is the main focus of our research efforts. This organization was founded in 2012. And at that time, our vision was to be able to diagnose these children at 7 days of age through newborn screening, not 7 years, as was the case at that time, and to have everyone receive an effective treatment right away so that they can have outcomes like my son Louis and live independent lives, not have epilepsy and intellectual disabilities. And really our ultimate goal is to close shop. As much as I love this calling in my life, and it consumes my life, and we want to not be needed. We want this to be a thing of the past. So started in phase 1, laying the groundwork of a lot of people who didn't know how to do what they wanted to do. They just knew what they wanted to do, and we worked with federal government to nominate GAMT deficiency. We worked with a lot of partners in this space and started our medical advisory board. Just for the look back, 2014, we had an income of about $10,000 that whole year. And over the years, we started to grow till 2019, we'd gotten to a point where we were raising about $163,000, and we had applied for a Rare as One grant from the Chan Zuckerberg Initiative. And at the end of 2019, we started something called a gene therapy consortium, which cost us nothing. It was the idea of, hey, interested people, we want to get you together over a Zoom to talk about what would it be like to develop gene therapies for creatine deficiencies. And from that, we started awarding very small $10,000 advancement grants to people who were like, you know what, I think I do have an idea and I want to start working on this. That was 2020, and now today there are 7 different projects going on. There is a GAMP gene therapy project that is funded by CIRM, and there are some really promising developments with CTD as well. So I just like to look back at that and go, you know, that seems like such a small amount. And in fact, someone talked about asking for, you know, $1 million and getting 10,000, and that it is a small amount. But I think, you know, when you're young and you're lean and maybe that's where you're at, don't feel shy to say, hey, like, this is all we have, but we're passionate, and are you passionate too? And I think we can move mountains together, and that's kind of been our lean and mean approach over these years. And in 2021, with the help of the CZI funding that we had, we launched something called our fellowship program. And this is this year's fellowships, 5 young researchers who have applied to the program and are working on different projects to advance our therapeutics. I look at the CZI grant as, you know, an investment in rare, which is such a hard thing to sell. But once you understand it, you understand that it's an amazing opportunity. You actually have a huge impact. I talked to a donor recently who said, I don't want to put my money in, you know, heart disease or cancer. I want it in something meaningful. And I was like, wow, you actually get it, you know, the first person ever. So the CZI grant really made a huge difference because we were able to build our capacity and invest in ourselves. And during that time period, we did get GAMP approved for the federal list of newborn screening disorders. Like I said, we had the Gene Therapy Consortium launched. We'd given 4 therapy awards. We'd made big hires. I was onboarded full-time as the ED. Our fundraising capacity went through the roof compared to where it had been. We started a variant curation expert panel to advance the understanding of our genes, and the fellowship program, and just on and on. We got our first PCORI grant, so we really turned the corner and our new organization, honestly, because of that time period. We also continued and grew our grassroots community fundraising. So this year is our 10th year of a walk around the world. We have families all around the world who on the same day have a walk in their community. Some are really big, 150, 200 people. Some are a family of 4. Taking a selfie, going on a walk, maybe pushing their child in a wheelchair or whatever the capacity is of that family. And it's a day of community unity, and also it is a nice fundraiser for our organization. And then at the end of every year, we do a Holiday Heroes where we're asking people to donate. We've expanded into other things like a Rock 'em for a Cause event. We've successfully, like I mentioned, implemented GAMP newborn screening in many states. The orange states are screening now. The blue states are planning to screen very soon. And we've seen our diagnosis time period shrink. So we're eking towards this 7-day diagnosis, treatment from birth vision. We don't have a great prevalence for CTD. It's X-linked, it's very complicated. We did our own calculations based on our community, what we know about GAMP, and we publish those on our website. So if we don't have a resource, we create it. We have developed a core outcome set through that first PCORI grant that I mentioned, and now we have the foundation for what we recommend for measuring in clinical trials, so we're prepared to have the patient's voice in those trials. We've funded these diverse projects, over $1 million in projects, And now we have some key assets that we feel are ready to move on, and why I'm so glad to have met this morning's panelists. So one big advancement this year that's, also helping us really move forward is one of our board members, Jeff Allen, won an international game show, Beast Games, if you've ever heard of that. Who knew? But he took home the $10 million prize, and now he's on a media circuit, and he is doing podcasts and interviews and just raising awareness. It's amazing, the families that we found just through him being on that show who said, oh my gosh, I'm watching TV and someone says CTD, and I thought I was the only patient all these years. I almost fell off the couch, and the connections that he is making are priceless. And because of that, and because of where we're at with several of our assets, we just announced the Race for the Cure, and we're taking proposals for higher funded research to get us towards clinical trials. And we've announced our Fueling the Future campaign, especially to focus on gene therapies and creatine prodrugs, on and on. And so how are we going to do this? How on earth are we going to support this? I think this is where we are the buffalo charging into the storm, and we're also spinning like 5 plates at the same time, and we're blindfolded, and we're just determined, and this is what we rare parents do, right? So we're going to have premieres of a Life of Lucas documentary about Jeff's son in different cities. We're going to be inviting media. We're going to be, just networking and building friendships, and doing everything we can to jump out of the plane, hang on to each other, hope our chutes open. And that's me, the cheerleader, who is regularly telling my board, we're going to do it. We're going to do it. Hang with me. Come on. It's okay. We're so close. That this is just our role, is cheerleading and leaping and not stopping. And I think we have some great partners in this space, and we would love more. So thanks for your time.
And now we're going to move to our next Heidi.
Thank you, Heidi, and thank you, everyone, for having me here. It's really an honor to, sorry, I'm looking for the clicker, here we go. It's really an honor to be here and speak with all of you, and to follow Heidi. That's so, and I think it's the first time ever I've followed a Heidi, and to talk to you about our work. So we are funders. I work at the Chan Zuckerberg Initiative, CZI. I'm a senior program manager on the team there and lead the work with the Rare as One network, which Heidi just described some of her partnership with. So specifically, I want to talk about the capacity building work that we do at CZI. Okay, I'm going to be like you now, Heidi. Okay. So our mission at CZI is to help build a better future for everyone. Our foundation was launched by Mark Zuckerberg and his wife, Priscilla Chan, a pediatrician. And the primary focus of the organization is in science, where we have a specific mission to help cure, prevent, and manage all disease by the end of the century. So that's obviously a very lofty goal, and we do this work in a number of ways. We have numerous initiatives, including 4 new grand challenges that were just launched a month ago, to develop an AI virtual model of the cell, to harness the immune system to better understand and treat disease, to develop tools. Sorry, this is all breaking news. This is my first time actually trying to say the 4 of them by memory. I should have made a separate slide, but it's not the focus of my talk. To develop tools to monitor inflammation and to develop novel imaging technologies to be able to better map biology in action. So in addition to those 4 grand challenges that are just newly launched, we have a program called Translational Impact and Engagement. And for those of you who've been following us previously, this used to be called Science and Society. It's now Translational Impact and Engagement. Very similar work that we're going to be doing under a different name. And the real goal of this program is to help bridge the gap between scientific discovery and application. So I think we heard a lot about this Valley of Death in the previous panel. And we are going to be doing this work through strategic grant making, investment, pilots, and networks. And so specifically, I'm going to speak about our work with the Rare as One network in a moment. And our goal is really to focus on changing the way science is done, to think about who needs to be at the table, specifically patients, but also many others, to spawn the tools and technologies that will accelerate science, and to generate alternative models and mechanisms for accelerating patient impact. And so in addition to the Rare as One network, which as I said, I'm going to speak about in a second, we have funded a number of research partnerships in the field. And here's just a sampling of those that are addressing genetic characterization and diagnosis. So specifically to develop screening tools from the diagnosis perspective, to develop screening tools utilizing claims data, electronic health records to improve diagnosis, to conduct genetic sequencing-based newborn screening efforts, and to, in partnership with patient organizations, to develop a publicly available prevalence estimator for autosomal recessive and dominant conditions, and to conduct identification of genetic variants and functional characterization. So these are just some examples of some of the works we're doing in the genetic space. Okay, our flagship project that I'm just so proud of is the Rare as One network. It's an incubator-style program that currently has nearly 100 patient organizations to date. We've funded 94 grants, but some of those organizations actually partnered with another sister organization in a different part of the world, and so we're nearly 100 organizations that have been funded across multiple cycles. And the fundamental goals of these grants are to build and is to really build the capacity of these organizations. And also from a scientific perspective, to begin to build their scientific capacity to really continue to lead work forward in their disease areas. So to build and strengthen a collaborative research network, to host at least one international scientific convening, to align their community through the development of a prioritized research agenda, so bringing together researcher and patient priorities, and to work collaboratively across their disease areas to identify common research goals and facilitate cross-disease research. And so when we selected these organizations, they were really chosen based on their ability to develop what their the way they describe themselves in their applications, in terms of their ability to grow and develop, and really how they were thinking collaboratively and about the potential future for their disease areas. They were not selected based on what they had in common scientifically. But as things went on, it became very clear to us that these very distinct disease areas actually had tremendous scientific synergies across them, and that there was really something that we could do to optimize for those and to support these organizations to accelerate work across their disease areas. And so our latest cohort of organizations is focused on 3 specific areas of disease: ciliopathies, channelopathies, and inborn metabolic disorders. And I suspect that in the future, our future funding rounds are also going to be focused in specific areas to try to really help develop these fields on the patient organization side. And so we have funded 3 rounds of the Rare as One network, plus 10 patient partnered collaborations, where we are funding both the researcher and the patient organization on a specific research project, naming the patient organizations as PIs on those, and providing funding for them to work in partnership with researchers in their disease areas. And to date, we've funded over $70 million to patient organizations. Fundamental to our program is a capacity building program. So in addition to funding, we recognize that many of these leaders, all of them, I would say, would benefit from different types of supports. So all of these organizations were, on average, less than 6 years old at the time of funding, had average operating budgets of $375,000, 2 or fewer staff, and the vast majority actually had no paid staff at the time of funding. And knowing also that people that come to this work generally do not come to this work by choice. They are thrown into this work unexpectedly, often having to leave their prior jobs, sometimes not being able to or not wanting to leave their prior jobs, and so juggling multiple things at once, taking care of their children or parents or whoever, or themselves, whoever is impacted by the disease that led them into this space. And really needing to develop, as we know, these organizations are kind of doing everything across the board: fundraising, driving forward the science, building patient communities. And so to support those efforts, we provide these organizations with scientific and organizational capacity building, with mentorship through a program with Faster Cures, with legal support through a program with We the Action, science advising, did I say that? And a place, most importantly, I think, a place for them to share their own challenges and successes with one another. So via a portal, a discussion forum, and in regular network calls. And so we've seen incredible impact of these organizations. All of them essentially achieved their core grant objectives. We actually didn't expect that to be the case. We were expecting to have a higher margin of error. And it was also during COVID that we funded our first cycle. So the fact that these really scrappy organizations were, able to continue and achieve this work was very impressive to us. And far beyond that, what these organizations did during the period of grant funding, I think is just really is something that we all need to pay attention to. So in terms of funding and supporting research, these organizations collectively engaged over 18,000 researchers. 46 started a new research collaboration, 23 provided funding to early career investigators, and they co-authored or were acknowledged in 288 scientific publications. They importantly developed critical research enabling infrastructure. So 46 of them developed a natural history study or registry during that period, 40 developed an animal or other model, 30 of them developed biobanks, 22 of them developed centers of excellence, and I think specific to the conversation here, 33 of them were involved in clinical trials. Again, these were organizations on average less than 6 years old. So the rate at which these organizations are having impact in their disease areas, I think, is unprecedented and really speaks to the impact that having capacity building support to be able to drive forward these initiatives can have. Specifically to our conversation here, we saw patient-led organizations playing key roles in gene identification, curation, prevalence, and diagnosis efforts. 28% funded or participated in gene curation efforts, 31% participated in prevalence estimate efforts, 40% led efforts to develop diagnostic criteria and guidelines, 10% provided funding for genetic testing, 21% for genetic testing outside of the US, and 59% of them led awareness campaigns. And so I think we can see the really important work they're doing in this area. And then specifically, in the, speaking to the development of gene therapies, we saw 1/3 of the organizations participating in the development of gene therapies. Again, these are brand new organizations, essentially. And this is just a sampling of this, more than 30 organizations that led this type of work. The Yaya Foundation funded creation of a mouse model to support therapy development. INAD Cure fundraised and established key partnerships for the development of gene therapy. Test Research Foundation, Kim Nye here, funded a natural history study that enabled the development of the gene therapy candidate and then continued to steward that work when it was essentially dropped, I think, by the pharma partner, and really, is working to ensure that progress continues in their disease area. The ACD that Heidi Wallace just spoke to us convened the Gene Therapy Consortium and is issuing regular research grants. And the PCD Foundation is supported research to identify the multiple genes in the disease area and to provide input into the development of the clinical trial design and enroll patients in the clinical trial. And so across the lifespan of this work, we see these patient organizations really playing key roles. And so just to say in summary, we really believe that rare disease patient organizations are key research partners who with funding and capacity building support can really have outsized impact in their disease areas. They're building trusted patient communities, articulating critical patient insights and priorities, galvanizing collaboration across their disease areas and at every stage of the work. Partnering in and funding research, creating research-enabling assets and infrastructure, supporting gene identification, curation, prevalence, and diagnosis efforts, and really driving forward the development of therapeutics in their disease areas. And so it's just been an incredible privilege to support these organizations and to hear from the many that are here today. And to any other funders out there, I really encourage you to engage in supporting their work. So thank you. My contact information is here if anyone would like to reach out. I also really encourage you to follow CZI's science funding page for any future opportunities. Thank you.
Thank you, Heidi. We're going to bring up our final speaker for this session, Carly.
Great. Good morning, everyone. My name is Carly Patterson, and I'm a senior advisor with the Patient-Centered Outcomes Research Institute. And it's really wonderful to be here with you all today and share a little tour of the opportunities that PCORI has available and give you some examples. So get started. Last but not least with the clicker, I guess. Okay. I almost want to keep my hand right there, but I'm not going to. All right, so we'll start with an overview. So PCORI is a nonprofit. We fund comparative clinical effectiveness research, and we're widely acknowledged as a leader in this space. But we also fund non-research awards, so engagement awards and dissemination and implementation awards. So we'll get into a little bit of detail in a couple of these areas that are relevant for this group. The mission of our organization is to help people make better informed healthcare decisions and improve healthcare delivery and outcomes by producing and promoting high integrity research results that come from information that's guided by patients and other stakeholders. So when we talk about the comparative effectiveness research that PCORI funds, there do have to be 2 or more alternatives, each of which has established efficacy and or widespread use for delivery in real-world settings. And so I'll be the first to tell you, having done work for many years at PCORI focused on rare disease research, many of the conversations that I have with folks in this space when it comes to the research opportunities, we will end up having conversations about both what might be appropriate for PCORI, but also where we're not a good fit. And also, the other aspect of the work that we fund that is critical is that every research study that's proposed and ultimately potentially going to be funded has to partner with patients and other stakeholders to answer a real patient-centered question. And so this can be clinical approaches across assessment, prevention, diagnosis, or treatment of a health condition, and then also alternate forms of healthcare delivery. So when we talk about patient engagement, PCORI has a robust set of resources. So I wanted to make sure and include this here, just so that you know they're all freely available on our website. And the tenets of that work include representative involvement, early and ongoing engagement, dedicated funds in research studies for engagement and partner compensation are a requirement, work to build capacity as a team, and the meaningful inclusion of partners, and then an ongoing review and assessment throughout research studies. And so this is really where PCORI, over the years since our inception in 2010, has spent a lot of time and resources developing resources for the public research community to use when it comes to thinking about when we say we want meaningful patient engagement and stakeholder engagement, what does that look like? So these are the foundations for that. So when we think about funding opportunities for PCORI, as I mentioned, we have the Comparative Effectiveness Research Awards. We also have Dissemination and Implementation Awards. I'm not going to spend a lot of time on those today, because that stream is really focused on dissemination and implementation of studies that PCORI has funded and are complete. But another aspect of our funding streams is engagement awards. And so these bring patients, caregivers, clinicians, and communities into the healthcare research process, and we'll talk about the different funding streams that PCORI has available. So when it comes to our comparative effectiveness research funding, PCORI is not specifically focused on rare disease or any other condition or symptom. We are a broad organization funding any aspects of healthcare delivery and healthcare research. So to that end, we do have a research project agenda that identifies topic themes that create opportunities for us to focus our funding. And so across all of those topics, right now we have 13. One of those is rare disease, which means that from PCORI you'll see opportunities for rare disease research funding specifically. And on that point, this is a slide that shows all of our research funding opportunities, of which there are 5 right now. I would point you on the left-hand side, the phased large awards for comparative effectiveness research and the broad pragmatic studies. Those predictably come from PCORI 3 times a year. The phased large awards or placer studies are up to $22 million. The broad studies are up to $12 million. We also have, like I mentioned, the topic theme-focused funding opportunities. This upcoming is our next issuance of our rare disease topic-focused funding announcement. Letters of intent for that will be due in September, and that is an up to $12 million opportunity. When we talk about the engagement funding opportunities, PCORI also has a capacity building opportunity up to $300,000 over 2 years, and also an opportunity for convening support up to $125,000 and up to 1 year. And these are not research awards. Again, these are opportunities for convening multi-stakeholder groups to help develop a research agenda when it comes to opportunities for patient-centered research, or for convening support. Relevant to the rare disease space, I think, is this other initiative that PCORI has. We call it PCORNet. It's the National Patient-Centered Clinical Research Network. This is a national scale resource we have to conduct patient-centered comparative clinical effectiveness research, over 13,000 clinical care sites, 47 million patients. And so we know that the power of networks is really important when it comes to small n's. And so I leave this with you just as another option that might be relevant for trying to get to the numbers of individuals, finding the individuals that you need to conduct the research that you're trying to do. And I wanted to close us out with just a couple of examples of successfully funded PCORI projects to give you an idea of, what are some of those studies that have been successful in the PCORI pipeline. So we'll start with an engagement award that focused on capacity building for developing a sustainable patient-centered research agenda. And this is one example I think we've had, in hearing the talks today, there's been a lot of success for PCORI awardees in the rare disease research space when it comes to engagement awards. We have funded dozens of rare disease patient advocacy organizations who are at the stage of ready to bring together multiple stakeholders to have a meaningful conversation about, what are the important priorities for research. and what are some of the important outcomes to patients, to clinicians, and to be able to have resources to actually meaningfully conduct those engagements. And so this is one example from the Test Research Foundation. And you can see here the objectives were to really foster collaboration and trust, and ultimately come away with a roadmap for the foundation and also for research, a research agenda. And then I wanted to give this example of one of the research studies that we have in our portfolio that's relatively newly funded. So this focuses on matched related donor hematopoietic cell transplantation compared to non-transplant and disease-modifying therapies for pediatric sickle cell disease. And this is a comparative effectiveness study. HLA, MRD, HCT is a cure for sickle cell disease, prevents future morbidity and extends life expectancy, but there's a real trade-off because of the side effects and the impact that this has on the lived experience of those who make the decision to undergo this transplant. And so this study will compare, it's two parallel multi-center prospective cohorts. So it's not an RCT, this is an observational study of individuals with sickle cell disease, ages 3 to almost 21. And the cohorts are leveraging existing registries that are already in place in the sickle cell community. And it'll be 320 pediatric patients receiving NT-DMT, and then 160 patients receiving MRD, HCT. And the primary outcome for this study is health-related quality of life. And so those are just a couple of examples of the funding. We always like to close with, there's a lot of opportunity to get involved with PCORI. I didn't want to take the time here, but we do have a rare disease advisory panel. We've had that since the inception of the organization, so we always welcome folks to engage with us, sign up for our newsletter, which is a great way to find out about the funding announcements that PCORI has available and upcoming. There are opportunities to become a merit reviewer, which in my conversations with merit reviewers or those who are interested in applying is a great way to learn more about what the process is like for PCORI, because it's not the same as the NIH review process. We incorporate stakeholders and patients in the grant review process. And so there are also opportunities to become an ambassador, peer reviewer, participate in our events. So I'd be happy to talk with anyone more about any of the opportunities that we have to get involved. And like I said, you can subscribe on our website for all things PCORI. This is my contact information. I hope this was a helpful tour of the PCORI opportunities that we have and some of the work that we have funded, and I will look forward to more conversation in the panel discussion. Thank you.
All right, I'm going to invite up our three speakers now to the stage for a panel. We have about 30 minutes. So again, just like this morning, you can come to the center mic. I'm going to kick us off again, and I'm going to put my co-chair, Kim, on the spot a little bit. You might have picked up in two of the presentations that the Test Research Foundation has been awarded both the CZI and the PCORI funding mechanisms. And additionally, one of the big absences you might notice today is that we do not have a representative from the NIH, which we initially had planned, but unfortunately they were not able to participate in today's panel anymore due to new regulations. So I'm going to punt this to Kim for a minute to talk just briefly about how their foundation utilized CZI, PCORI, and they've also had an NIH funding mechanism for the Test Research Foundation.
First of all, I want to say thank you to PCORI and to CZI and everyone who is investing in advocacy organizations and really helping us build our capacity. It is just an incredible thing to feel supported and to have the resources to actually make progress, so thank you. I think in terms of our funding. When we were part of cycle 1 for the CZI grant, and honestly, the idea of investing in our internal capacity seemed really foreign. We were an all-volunteer organization, and we wanted, we bragged about the fact that every penny that went in went right back out to research. And I really didn't understand the importance of treating our organization as a business and having, a staff and a team that could really grow our impact. So that grant for us changed everything. We invested in a full-time scientific director and an operations director and a development director, and it really created this sustainable team. And when that grant ended, my big concern was, how are we going to continue this? How are we going to continue to have this amazing team? And we were very fortunate to receive a grant from PCORI, and we were a part of their small organizations program, which was really perfect for us because all the groups were not all rare disease groups. In fact, there were only 2 rare disease groups, so it was different from our CZI experience in that sense. But all of the organizations had smaller budgets, and so we were facing some similar problems, and it's really been great. In terms of money from NIH, we have found it harder to have patient organizations receive funding through NIH, although we are, our groups are technically eligible. We have found that we give out a lot of letters of support, but when we go to researchers to say, hey, can you, have some funding come back to our organization, those are harder conversations to have. We have successfully received an R13 grant for conference funding, and we did that by partnering with an academic institution, in our case, UT Southwestern, and that was a really successful experience to convene our community and just help researchers build trust among themselves, and hopefully that leads to more collaborations. Does that kind of answer? Yeah. Okay.
All right, Kara?
Hi, my name is Kara Wiseman. I work for the Orphan Disease Center. We're a rare disease nonprofit in Penn Medicine. My program specifically, and the work that I do, is working on a program of excellence of MPS and lysosomal storage disease. And we both fund research in natural history studies and encourage data sharing and finding ways to work together. I'm involved personally in multiple rare disease natural history studies and collaboration efforts. But we found, even though we do fund and we have limited research funding because we are from philanthropy, we are always looking for additional funding for either our organization or other organizations that we partner with to move that forward. However, we found a lot of challenges in the data sharing space in finding ways to fund these collaboratives. If there's any suggestion on how we could do it, we've looked at things like PCORI, we've looked at Chan Zuckerberg, but we've not found the right pathway for us. So any guidance on how to really uplift these really extremely important aspects that really do move all science forward, we just haven't found the niche or the right program to apply to that speaks to the work that we're doing, which is specifically collaborating additional, data sets, natural history studies and registries from multiple different areas to then share and empower those groups. So any feedback would be really great, and I'm sure a lot of people would be interested as well. Thank you.
Thanks for that question. Can I just clarify, sorry, before you leave the mic, are you talking about data sets within an individual disease area or across disease areas?
Both, actually. I work specifically with 2 different collaboratives, and we also work with the CPATH Collaborative, which is kind of an overarching group, if people don't work with them yet, on lysosomal storage diseases. So in that area, it's very broad. I'm not necessarily looking for funding for them, but for our individual disease collaboratives. Yeah.
Yeah, thanks. So I know there's NIH funding through the RDCRN and opportunities like that, where there are natural history studies that are supported across disease areas. And I would say, our work at CZI is really evolving right now. So as I said before, I really encourage people to continue to follow it. As I also said, I think we're really starting to think about how we can support kind of collaboratives of diseases. So currently we're funding cohorts within specific disease areas, but I think there's other ways that we'll be thinking about that too, like how can we, lift more boats at the same time. And so just to say, I would encourage you to continue to follow it, and I'm happy to have a conversation and learn more about what you're doing.
have a little bit that I can add. It's unsatisfying in that I don't, PCORI, it's outside of PCORI's remit to fund the start of any natural history of disease studies, but we do have at least one example that I can think of in our portfolio where we have had folks use the comparative effectiveness research funding as an opportunity to enrich, deepen the data that's being collected in an already existing and already started infrastructure for natural history. So I think my thought there is really just like, how can we be creative with the opportunities that exist when it comes to funding to, we have what we can fund, but there are other aspects that might be able to be enhanced about the work that you're trying to move forward on all these different fronts, that could still support, even though it's not going to be the main focus.
Yeah, just to clarify, so these are collaboratives that bring together existing data sets, so it's not investing in natural history specifically, but it's getting the most out of these data sets so we can mine them for things like genotype, phenotype, and endpoints and things like that, but also to be collected together to be used as potential, phase 3 non-placebo controls. So I think that there's a lot that brings this together. And we also are doing things like holding workshops to create frameworks to empower other people to share data. So I think it touches on a lot of things. So thank you so much for your feedback, but I hope that we can find ways to fund this kind of work because it's happening through collaboratives that are being driven by patient organizations, but it can't be all on their backs. And we've tried to find industry as ways to help fund it, but they're not really necessarily interested in that. And it's hard enough to get the industry data to be in a place where we can use it as in addition to have them funded is not really working as we all would have liked. So yes, thank you so much for your attention.
So my name is Shomit Dasgupta. I'm from the International Fox P1 Foundation. So everyone knows Nasha from Fox G1, and we're a related gene called Fox P1. And my question, I have two questions for both Heidis. So for the first Heidi, you mentioned an increase in your fundraising by 558% after you got the CZI grant. Would you say that getting that grant was directly related to that increase? And secondly, where did those funds come from? Was it patient families or was it other broader fundraising?
That's a great question. It came from our families, and it was a combination of things. When we launched that gene therapy consortium, we had that light bulb moment of, oh, when you fundraise for something really specific, people get a lot more excited. So in the past, it had been like, support ACD, support our mission, and we had these really small results. And at the end of 2019, we ran a campaign, and it was like, all I want for the holidays is gene therapy, like that's what we're going for. And bam, everybody turned up, and the participation was so much better. And then following that, during the CZI grant period, we had a lot of trainings with people who were experts in how to fundraise, how to deliver that message, and it really kept us going. So it was a combination.
So, yeah, sorry to follow up, and also on the backdrop of some of the discussion we had in the morning where there were very wealthy families that were giving 7-figure donations. Are these, like, how big are these donations coming in from families? Are they 4-figure, 5-figure, 6-figure donations? Like, what is really driving the increase when you're ramping up from an organization that you said had $150 or what was it, $160,000 to now over $1 million, presumably? Like, what's the main driver of that increase? Is it a few really wealthy families? What is the driver?
Yeah, you're like, the big donations make all the difference. And I think, like I said, having more specific things to fundraise. So just as the organization matures and the needs mature and they get more granular, so you have more details to share, it's more compelling. And then there's this huge element of luck. Like, Terry Jo Bichelle always says, like, what do you need? You need a celebrity in your community. You need a celebrity to have a child with your child's disease. And you can't make that happen. There is this element of luck of who gets diagnosed. And like I mentioned before, since Jeff won the Beast Games, we've had a lot more people coming out of the woodwork, and some of those have said, all right, we want to support. We're a new family, we want to support to the tune of $1 million. I need more details on exactly what you're going to do with the money if we support. And so now we're doing the RFA, and it's the race for the cure, and it's, give us your proposals, give us your data. We need more people to be more forthcoming and transparent so that we can be more forthcoming and transparent. And it's just kind of this cycle of many, many factors coming together, I feel like.
All right, thank you. And sorry for monopolizing time. For the second, Heidi, I had a question of, our disease we didn't feel fell into the categories that you were funding for the Rares One network, and I was wondering if you're planning to have a broader call at any point that might include like neurodevelopmental diseases. Thanks.
Yeah, so I can't comment on whether your disease area would fall into a field that we're considering, because we haven't named the field that we're next considering. So, but absolutely, I mean, your type of organization, patient-led rare disease organizations are the types of organizations that we support. I suspect that we will be launching new initiatives in the nearish future, in the next 1 to 2 years. Where we will be funding patient organizations across a number of disease areas. And I think that answers your question, but just to follow up on Heidi's comments also, I do think that the major donor fundraising is a really key aspect of this work that a lot of patient organizations, I think, typically haven't invested a lot of time in and have spent more effort around community fundraising activities. Not to downplay those, because I actually think they're really critical. Even if the return on those is smaller, having an engaged patient community is really critical as you get further down the line. And you're getting towards clinical trials and all the other steps along the way. Like, you really need those patients to feel invested in the work and with your organization. And so absolutely, like that continues to play an important piece, but I think working to identify who those major donors might be in your community and really developing the practices to engage them is critical. And I know in some ultra rare conditions, it seems like you just need the celebrity to be diagnosed, but like thinking instead about, who maybe you could bring onto your board who has those types of connections and that type of thing is something to think towards.
Hi, I realized I didn't introduce myself before. I'm Jerry. I'm a pediatrician by training, but I also have a daughter with a rare disease. There were about 30 in the world when she was diagnosed. We're up to about 65 now. I was just, for the folks up there who've been successful in grant writing, I feel like as a pediatrician, it is totally not my wheelhouse. Like, I looked at the Rares One application and I was like, this is asking me the same question 5 times. I don't speak enough business speak to possibly begin to answer these questions. Have you ever considered hiring a grant writer for these, or what has made you kind of successful in that way? I went to med school with Priscilla, and I was always very jealous that she could cross that like business speak, medical speak sort of cavern that's there.
We did hire somebody to help us with our CZI application. We were heavily involved and partnered, and so I wouldn't say that we gave it to them, but we did get some help, and we also had some help from the same person in our first PCORI application, and we got a second PCORI grant actually. And I will add, the first PCORI grant we got, I think we had applied 6 times prior and not gotten awarded. So it took a lot of repeats, yeah. And then our most recent one, we got it first try, and I think we just really kind of knew our niche and our value to our community and what we were doing, and we were super, super passionate. It was less of like a spitball, like what could we do? And more of, it had grown out of the first project, and yeah, you just have to answer the question again and again and re-say it a new, fresh way, and just keep sounding excited, and yeah.
Right, just to say I'm taking all feedback regarding the application. we did think very carefully about the questions and what was intended with each one of them. And I mean, there were different angles to each one. I will say that I think there's a communication gap, I think, between the funder and what we sit in a room like imagining is what we're trying to create, and everyone that's just out there doing their own thing and maybe wants to be a part of that vision but doesn't fully understand it, or we don't also want to completely direct what others are doing. We want to be supportive of what you're doing. And so I think there is that gap sometimes, and I think, but my only advice can be to really read the questions really carefully and try to answer as specifically as you can, and to really let who you are come through. The organizations that we selected were really ones where we believed in the potential of the leaders. We heard so much in the first panel about lean organizations and having the right people, like who are the people that are doing this work, what's driving them, how do we know they're not going to, stop, and that they will make thoughtful choices. Those are the types of things we're really looking for. How collaborative they are, those types of things. But we really do appreciate feedback about the application. So I'm, no, I know. But I think it is important to hear that feedback, and so I appreciate that also. But I do know that a number of organizations hired grant writers, and also we've received feedback that a lot of the organizations have spoken to previously funded organizations in the Rare as One network. They're all listed on our website. And I think that's been helpful to better understand the priorities of what it is that we're trying to do with the funding, and maybe how they worked on the application.
Kim, do you want to comment?
Sure, I can speak to what we did. So for the CZI grant, I wrote that because that was it. That was like our whole organization, like in all honesty. Like we didn't have a big team. I did get some of our scientific advisory board members to review it to make sure it seemed appropriate. Since then, I have talked with a bunch of groups, like a lot of organizations will reach out and ask about that grant application specifically, and I think that the amazing part of that community, like I met Heidi through that community, I mean, both Heidis actually through that experience, but we've all become really supportive, I think, of other groups, and you'll find that people are there to help you. There are some groups that will even send their application and ask, if one of the successful awardees will read it. I mean, I think it all just depends on each group's comfort zone. We were nervous about PCORI, if I'm being honest, because it tends to have like a vocabulary that is unique and an application process that is unique. We had like a consultant, so not a grant writer, but we talked with someone for just a couple hours about what might be, in line with PCORI, and then we wrote that application ourselves as well. We don't have a ton of extra funding, so we do keep more things in-house than maybe some other groups, and that's just so that we can continue to support everyone's salaries who's on our team, so there is an expectation of grant writing for our staff. But I think that you'll find that everybody does it a different way, and the main thing that you have to lean on in rare disease is you just go with whatever you have. So if you have a team internally that is strong at grant writing, then you use your internal team. If you don't, then you hire people outside. Like whatever you have, whatever resources you have, use them, and whatever you don't have, find it. And whether that's through board members or through contractors or consultants, like absolutely go for it. And I will also say that even though I feel so grateful that we've had some successes, we have had way, way, way more rejections. So it's also about just continuing to try to find the funding for the next step.
Yeah, if I could just add one more thing to what Kim just said. Be persistent. I know that it's really dissatisfying to say that. I should have said maybe at the outset, I've been on the other side of this also. I have 2 children with a rare disease and was on the board of the foundation in their disease area for 8 years before coming to CZI, and I still do that work at midnight. But so I understand how hard it is to complete these applications, to find the time to do that. On the other hand, I can't remember the statistic exactly. I'm sorry if my information is incorrect, but approximately 50% of our currently funded grantees were prior applicants. So it is so hard for us to make these decisions. There are so many deserving organizations, and we need so many more funders at the table. But there's so many we want to fund, and we try to get there. So keep trying.
I just want to add one other thing that hasn't come up, and that is, at least for PCORI, we've done a lot over the years to try to make it more clear that we're open to conversations, because I think you can spend, we can't help with the writing, obviously, and like Heidi said, we try not to be too directive. We scope what we hope to fund at the 30,000-foot view, but like we've created other opportunities, office hours, where you can sign up, trying to open or show that we have a door that you can come and ask. So I would encourage, always asking for either the fit call up front, just to have the conversation. Are we a fit or not? And the more specific you can be in those conversations, the easier it is to answer those questions. And then when rejections come, those are some of the conversations I think that can be the most valuable, because there's so much information that comes in that feedback that you can then have a conversation again with the funder if that's something that they're open to. So I would strongly, strongly encourage considering that, reaching out and seeing where that takes you also.
I agree on those calls with PCORI, very helpful, like the fit call and the open calls, they're like so helpful.
Sam?
Hi, Sam Hughes, St. Jude Children's Research Hospital Translational Neuroscience Initiative. I'm thinking a lot about the historical NIH-funded rare disease clinical research networks, and where we're at right now with the original consortia, the funding sunsetting, and causing a lot of, in some ways, identity crises and definitely funding crises. And also in the kind of current setting of the NIH landscape and the existing research networks and then the new ones that have been proposed. I'm wondering how or if organizations like CZI and PCORI are thinking about that structure of organization, and in the absence of NIH funding, especially an established kind of route of NIH funding, of how CZI or PCORI or similar kinds of organizations could support the ongoing work of those groups.
Yeah, thanks for the question. It's a difficult one. We've been evaluating this really unfortunate challenge. And so my children's disease area was also a part of one of those consortia, the Genetic Diseases and Mucociliary Clearance Consortium. And I know how absolutely transformative they have been. Our focus at CZI has currently been on funding patient organizations, really believing that patient organizations are playing a critical role that's been completely under-recognized in supporting and driving forward research in their disease areas. The RDCRN did not actually fund the patient organizations to participate in that work, although I would say that they were groundbreaking in really engaging patient organizations in research. And so it's a space we've been evaluating, because we have not been funding the type of research studies that the RDCRN supported, and yet we see the gap. So it's something that we're looking at. Also thinking if there's other types of specific challenges across those consortia we can think about supporting, for instance, like data harmonization or specific pieces that need to be supported. So it's something we're exploring.
I think for PCORI, it's also thinking about, as a funder, what falls within our remit. And so we have the patient-centered outcomes, the PCORNet program, so our own infrastructure, if you will. I had an intern a few years ago do a couple of looks at overlap for me, just because while we were working on our first rare disease funding announcement, I wanted to know what is the overlap between PCORNet and the rare disease CRNs. And it was substantial. It was over 50%, closer to, I think, 75%, if memory serves. And so while I don't think there won't be an opportunity for PCORI to pick up that baton, there is a lot of overlap, and that means that those partnerships are probably there ready to be leveraged if you were going to come into PCORI with a comparative effectiveness research application. So I think some of that is just thinking about, like we've been talking about all morning, how are we nimble, how can we pivot? And I think that's where those fit calls can come in handy, because staff can tell you everything about the funding opportunities and what might work, what might not, and what you absolutely have to have, and what would be a nice to have. So I think those are some ways to think about, we might not be able to pick up that baton, but the funding is available. There's overlap in those potential partnerships that exist.
The one other thing I would say is that, as I mentioned earlier, we've launched these 4 new grand challenges at CZI, and so to the extent that any of the prior work taking place might relate to those grand challenges, I think there might be opportunity there. But those are spaces that we're currently developing, and so would welcome your thoughts if you saw opportunity there.
Yeah, I already made notes on that. Thank you.
Zaina Dupay here. What are the emerging trends in cell and gene therapy funding that you think will shape the future of rare disease research?
Sorry, just to repeat the question, what are the thoughts around cell and gene therapy that we think should be supported in rare disease research?
Yeah, what emerging trends around that funding are you seeing?
So again, I'll say that I think from our perspective at CZI, what we're currently supporting is patient organizations and the work that they're doing. So we have multiple arms, and the 4 grand challenges that we're currently supporting are really focused on pure research. And then the work that we're doing, the translational impact and engagement arm, is really focused on the patient organizations and research that would, and activities that would allow for that translation to take place. And so our efforts, the efforts that I lead at least, are particularly focused on patient organizations and what they're doing to mobilize efforts in this field. And so all the examples you've seen up here today.
Yeah, I think this is one of those conversations, at least for PCORI, that is a little bit challenging. And in the years working on this area of rare disease, I think we have a lot of success as an organization supporting engagement, so patient organizations who are building those research agendas. But then there's this chasm, I don't know what else to call it, for PCORI, where really the comparative effectiveness research we fund, it's post-FDA approval. It's already on the market. We're talking about available therapies at that point. And so I can see a horizon, certainly, where there might be an opportunity, because there's still a lot of questions to answer when you get to an approved therapy and people start receiving that therapy, and that's really where PCORI comes in. But there's a big space in between, at least for our organization. So I think we've tried to call for our interest in emerging innovations, and we want to have those conversations about how much is enough evidence for it to make sense to do a comparative study now of available treatments or delivery strategies, for example. So I think if there's ever a potential opportunity, that's a great time for a conversation to be able to understand, all right, does this comparison fit for PCORI? Because I think for us, when it comes to gene therapies, I went through our portfolio to get ready for today. We don't have a funded study yet that involves a gene therapy. And I think that speaks to where the field is right at this moment when it comes to comparative effectiveness research, which is what we're mandated to fund. But we are always looking to the horizon for what's emerging and what might be some of those opportunities for potentially disruptive treatments or therapies. So I think there will be more to come. We're not quite there yet for our organization.
And that might also go back to some of the discussion we had this morning about when is it appropriate to engage with academia versus then, some of that early discovery work where researchers and basic science labs can get funding from the NIH to do some discovery work, and then when's the best time to, move to the next step and, engage other types of organizations that might be able to help with either growing the capacity of the foundation or moving on to toxicology or manufacturing. So I think there's different organizations that might be, ideal partners at different phases. Okay, so I'm going to do my lightning round version of my panel question for this panel to wrap up this morning's session. If you could ask one thing of the broader ecosystem, whether it's foundations, funders, businesses, or government, what would it be to better support rare disease research?
Oh, I would love a way for it to be, I would love to have a much more straightforward answer to the question of how can we be more efficient with our funding opportunities to really challenge ourselves to work on that. In the years I've been at PCORI for 8 years now, and it is an incredibly complex ecosystem and really difficult, and I would love for us to be able to work more on improving some of that efficiency.
I think it's those incentives like the priority review voucher. It's just that level set where we need more, we need a little leg up, and that's what I asked for.
I think you're probably getting my theme by now, but it's absolutely to support patient organizations in all the ways that you can. So to engage them as real partners from the beginning of the work through to the end, to recognize them for their contributions, their names should be on every publication that they're supporting and working on, and where they've created the infrastructure that you're relying upon in that research, and to really, we need more partners in the field funding these organizations. There are 10 to 15,000 rare diseases. There are new organizations being spun up every single day by desperate parents and patients. And we've seen, I hope our impact study is showing the totally outsized impact these organizations are having. They are fueling research at kind of unprecedented rates and creating infrastructure that researchers are really reliant upon, and which will ultimately lead to therapeutics. So, sorry, that's maybe not lightning fast answer, but patient organizations need this support.
All right, well, with that music cue, I want to thank you all on behalf of the Patient Outreach Committee for ASGCT and our co-sponsor of this workshop, NORD, and my co-chair, Kim. Thank you for attending. I hope you found some useful tidbits of information this morning from different advocacy organizations and their different models and how they've gotten to where they are today. And from the second half about different ways to diversify funding and revenue streams. We hope you found this workshop useful, and thank you for attending, and thank you to all of our speakers.